So good afternoon. I'm here with Dr. Peter Lachman, CEO of the International Society for Quality in Healthcare. Peter will be speaking at the Calitropolis webinar on Wednesday, 30th of September on the topic of new technologies to make a difference in the COVID era. And just to give you a brief background on Peter, he has assumed the position of ISQua Chief Executive Officer on the 1st of May 2016. He's fantastic experience as a clinician and leader in the quality improvement and patient safety. Dr. Lachman was a Health Foundation Quality Improvement Fellow at IHI in 2005 and 2006. Developed the Quality Improvement Program at Great Ormond Street Hospital, where he was the Deputy Medical Director in the lead for patient safety. Prior to joining ISQua, Peter was also a consultant paediatrician at the Royal Free Hospital in London, specialising in the challenge of long-term conditions for children. Dr. Lachman has been the National Clinical Lead for SAFE, a Health Foundation funded programme which aims to improve situation awareness in clinical teams. In Ireland, he is the lead international faculty at the Royal College of Physicians in Dublin, where he co-directs the Leadership and Quality Programme in develop clinical leaders in quality improvement. He's co-founder and chairperson of Pipsqueak, the Pediatric International Patient Safety and Quality Community. So, without further ado, let me begin by asking Peter the questions you presented today. Why do you think the application should be implemented in Romanian hospitals and also abroad?
Okay, thanks for asking that question. In terms of what's happened in the last 6 months, is that healthcare has changed and we've seen a rapid move towards implementation of digitalization, telemedicine, and use of technology to achieve things that we could do face-to-face. So interventions like this, like the MediQapp, is really aimed at making it easier both for the person receiving the care and for the person who is providing care, so for the patient and the healthcare worker. What we really need to move to is having more self-management, more ability to access data, and ability to follow clinical guidelines from the provider side and to receive the correct care from the patient side. So apps like this, which aim to make it much easier to get information across, will be very important going forward in all countries. So it is a solution. It's not the only solution. It's merely a tool. What has to go with it are all the things around it, the culture of safety and quality as well.
Thank you, Peter. To bring us on to our second question now, why do you think the application would be of great help to hospital managers?
Well, one of the key things in a quality program is using the fundamentals of quality management systems. That means you have to be able to plan for quality, you have to have quality controls in, and then you have to have quality improvements. This comes from Duran and its Duran trilogy. And if we just apply those 3 measures, then using technology to do this is very important. It helps you in planning what you have to do, and in setting the controls, i.e. the measures that tell you that quality is happening. So I'll give you an example. If we have a person with hypertension, how would we know that that person is receiving the right care, that the right guidelines are being followed, and that the right information is being given across to the patient? And likewise, how do we know that the patient's reporting outcomes that are beneficial? So any way we can do that in a digitalized way will make it much easier for hospital managers, because then they'll know about the quality of the care that's happening at the front line. And they need to know this in real time. So if this can be achieved, then that'll be really great and will improve the outcomes, because once you have data, the outcomes will be much better if the frontline have data, and as well as the patients, if they have data about their care.
Excellent. Thanks, Peter. For our next question, what was your experience in other countries which implemented applications similar to the MediQapp?
Well, put it this way, the use of apps and of technical data is very variable. Depends firstly where it's been applied, and how it is applied. So my current experience is that you have to have an app that has the right data, the right processes, and it's easy to use both for the patient and for the provider. It must add value to the process, mustn't be more work, and must give just the right data. So if you go out in the marketplace, there are many healthcare apps that are being used right now, and it is really making a difference for healthcare. So I'll give you an example. Now you can have a watch that tells you your ECG, tells you your heart rate, gives you your amount of exercise you're doing, the kind of calories you're eating, and so on. Now that's very important. The only problem we have is in the uptake of these new technologies for people who are not familiar with apps or not familiar with the digital technology, either on the provider side or on the practitioner side. So for example, with the elderly population who are not so used to using smartphones, that might be a problem. However, there's some many situations where the elderly are very much involved in using iPads and smartphones. And now in the COVID era, that has changed. So I predict that what will happen is that digital technologies are going to become more and more popular as people realize that they are a tool that can be used to solve this problem of social distancing, of having virtual healthcare, having telemedicine, and of being able to manage yourself without having to go to see your doctor. So yes, I think that there is a lot of potential.
I believe you may have already addressed this final question, asking what problems have the medical collectives encountered, but I also note you've provided some solutions. So are there any other problems that you may wish to address in this interview?
Well, one of the big things in this is in the social determinants of health. We often assume when we come out with digital solutions that they will be good for everyone. However, if you are poor and don't have internet access, you don't have a smartphone, you don't have the capability to have broadband, then these kind of apps and kind of interventions discriminate against you. So it's also then is between rural and urban areas. So even if you think about it here in Ireland, if you live in Dublin, your broadband is much better than you live in a village outside of the capital. And I'm sure that applies in Romania as well. Depends where you live as to what broadband you would have and your access to the internet. And that is going to be a big discriminator. So the social determinants of health could be impacted by this. In fact, it might discriminate against some people and only be beneficial to those who can have access, who can download it, and so on. So we need to think about those constraints as well when we're bringing out these kind of solutions, that they may not be solutions for everyone. And that is a big problem. There has been a lot of research recently on justice, on the discrimination of using digital solutions, whether telehealth discriminates or whether it provides a benefit. And finally, the other one is that at the end of the day, digitalization is not the answer. This is just a method to improve care, because face-to-face interaction with your doctor or your nurse, your clinic is still very, very important. And people have reported that it's very tiring for the healthcare providers to do just digital health. But so this must be aimed to make their job easier, not to add to the burden. So those are the caveats I'd add to this. And if you think about it ahead of time, then you can mitigate against the access problems, the internet problems, broadband problems, ability to access and use the data, and also the, I'd say, IT illiteracy of some people. In the next generation, be very different.
Thank you, Peter. And to learn more about Peter and the work that we do at ISQua, visit isqua.org. We are the International Society for Quality in Healthcare. We're a membership-based non-for-profit community whose mission is to inspire and drive improvement in health and the safety and quality of healthcare worldwide. We achieve our mission by providing all members of the ISQua community with 3 core values: knowledge, network, and voice. If you'd like to follow Peter online on social media, his Twitter handle is @PeterLachman. And just to finish off by saying, Peter will be speaking at the Calitropolis webinar next Wednesday, 30th of September. Thank you very much.